Now, talking about the mild and severe, that whole range, can you give us examples of severe traumatic brain injury?
So a severe traumatic brain injury is someone who is probably not conscious when they come into the acute setting. Even when they do regain consciousness, they may be confused for sometimes more than a week. Sometimes you see patients 2 weeks after the injury, they still do not know what day it is, what time it is, where they are. Sometimes they don't recognize family members, even though they're able to have their eyes open, they're able to eat when you give them food, but yet they're not really aware and alert of their surroundings. So those are all suggestive symptoms of severe brain injury. If they have a bleed, if you do a CT scan and there is a bleed, then it isn't mild anymore. It could be anything between a complicated mild to a severe brain injury, depending on the bleed.
Okay, and talking about the patients, how is it for a patient to have traumatic brain injury? Can they lead a quality life after that?
So it depends on the severity of the injury. It depends on which area of the brain was affected. So someone with, or most people with mild traumatic brain injury on the whole recover completely. Most of them do. Whereas those with moderate and severe traumatic brain injury have got a higher chance of being left with a residual deficit, which could be some amount of weakness or some amount of problems with their memory. Now, of course, with rehabilitation, everyone can improve to a certain extent, but how much they improve is very dependent on the severity of the injury in the first place and the area of the brain that was affected.
So it's a case by case?
It is very individualized, yes.
Okay. Talking about rehab and the treatments that you guys offer, if a patient comes in, what are the first things that you guys say that, okay, this is what we need to handle first before moving on to anything else? Or is it still a patient by patient?
Okay. While there will be similarities, the program has to be individualized because we say whether it's a stroke or traumatic brain injury, no two patients are the same. So we always start with a full assessment, and the assessment is a physical assessment. We have to look at the medical background of the patient as well. We are looking at how well the patient is currently functioning, and very importantly is to look at the social status of the patient, because things like social support, the more support a patient has, the better the outcome they get. And so all of this has to be looked into before we can sort of say, okay, this is how your program is going to be. The other thing that we do in rehab medicine is we set goals. We find that if you just work on everything at the same time, the patients don't do as well and they get a bit frustrated. Whereas if you pick specific goals, like we would say, okay, for you, my goal is the goal that, and of course the patient has to agree with the goal. Our goal is going to be to improve your gait so that you're walking better. And for patient A, it may mean that we want to do more strengthening because the problem is actually in terms of power. With patient B, we may find that it's not really power, but it's your problems with balance that's affecting your gait. So depending on what is affecting the gait, we tailor the program to address those issues. Sometimes we need to use aids to help the patient. Like if you saw Encik Bahtiar, he had a carbon fiber AFO, and that has really helped him improve his gait by clearing the ground. It also helps him with energy expenditure when he walks. So those are important things to know when you need to use the right aid for the right problem.
And for people who come in, patients, you were talking about support. Now, how important is that support? Does it really help the patient, or is it really as important as because Mr. Bhakti was talking about how important his family was to him, you know, being there for him and things like that. How important is that?
Very, very important. Patients with good family support are more motivated. They, I guess, having the better support system helps them to just overcome the emotional hurdles better. So it's difficult trying to be independent when you have a disability, and having someone to train with you at home is really important. When we finish the inpatient program and patients go home, the rehabilitation doesn't stop there. We need to make sure that whatever they've learned in the hospital is carried over at home. And when they have the support, people who have learned, come into the hospital with them and learn what to do and able to help them at home without doing everything for them, that's when you see the most improvements.
Now, for patients with disability, one of the most common issues is depression.
Yes.
How does a rehabilitation hospital handle that?
Yes, depression is common in people with disabilities. So we have a psychologist who comes in to help us with that. Sometimes we start them on a low dose of an antidepressant if needed. We have a visiting psychiatrist if needed. And the thing about rehabilitation is that it is never one discipline managing everything. It has to be an interdisciplinary program. And so depending on the disabilities of the patient, the medical condition of the patient, we have different team members. We've got a neurologist, we've got a psychiatrist, a psychologist, we've got our physiotherapist, occupational therapist, speech therapist, and each one comes in depending on what difficulties the patient has. To help the patient achieve the same goal. So we're all working towards the same goal, but each one doing different things.
Okay. Now, one of the most important questions that everybody's going to ask watching this is, how much does rehabilitation cost?
Okay.
So that's one of the biggest questions, and everybody watching at home should be asking this question. So, how much does the rehabilitation program cost?
Well, that's the problem with rehabilitation because it's so individualized. So some people may need less therapy, maybe more medical care. Some people may need more therapy, very little medical care per se. And so in a rehabilitation hospital, if you have an infection, that's antibiotics, the cost goes up. If you're otherwise medically stable, then the cost is much lower. So I can't give you a ballpark figure because it's very individualized. But we do want as many people to benefit from rehabilitation as possible. So we have our community social responsibility program, which is called our Wish Upon a Star program, and we will be running it again this year, where we invite anyone who has a disability or who knows someone with a disability to just make a wish, and what we will do is try and choose as many as we can to get rehabilitation, either free or a very discounted rate here at Region Rehabilitation.
How can they contact you for this event?
So usually our marketing team will put out, it'll be on Facebook, it'll be on the media, and all they have to do is to make a wish on our Facebook page.